I just want to respect your time this morning. And first and foremost, I really appreciate you guys being on with us. Um, I feel like there's been some longevity with this pandemic, right? And just to be able to find these touch points, to be able to connect and share thoughts about what we're doing, what we're working on, goes a long way. So really, I appreciate you guys for being on with us this morning. Over the past couple years, now that it feels like as we've had to pivot and adjust, so much of the good work that's gone on in the community has really been such a collaborative effort. From programs we've had to a lot of the things I know you and your organizations have done. So we greatly appreciate that. For some of you who may not have been on this call before, or maybe you're new to this, the Healthy Hopeful Community Collaborative is really just a culmination of different organizations and leaders to come together and share thoughts and how can we pool our resources together to take them farther. And at the end of the day, that's what we want to do. So as we hear from some of the folks who are providing some updates about their work, we really like to see where things can go. So if you hear something and you're like, that's a project or that's something I really want to get connected in, feel free to put it in the chat. If you have questions, throw it in the chat. We really like to see where things can go with this. So we're excited, but please, ask questions if you have something you want to add or ask to, the folks who are chatting this morning. Wave your hand up. Throw it in the chat. Do something, and we'll get you to be able to ask your question. So, with that, in the best interest of time, we've got a few folks on to provide some updates about their work. I'm very excited to hear from them. So, Jessica, I know I just saw you on here. There you are.
Hi.
Yeah, Jessica Clayton. Yeah, so Jessica's the president and CEO over at the Daily Living Centers of Oklahoma, and we had the great opportunity to tour the facility. Not too long ago, it was maybe a couple months ago, a month and a half or so ago. And you guys have got some really great stuff going on over there. You guys are kind of tucked away, and I hadn't, before we had connected then, hadn't known much about what you got going on. So I'm excited to have you on and for everybody to kind of hear about what your work is and what you guys are doing.
Absolutely. Thank you so much for this opportunity. I'm very excited to get to know everyone on this call. And like you said, community partnerships are very, very important to our organization. And any way that we can collaborate and help one another is just very exciting for us and our team. So Daily Living Centers is a nonprofit organization that provides respite care for our caregivers in the community. We serve senior adults and adults with disabilities that are 18 and older. We have 4 locations that we serve the community. We have a Bethany location where our administrative offices are located here. We serve about up to 80 participants. At this location, we have a Northeast Center that's actually in partnership with Oklahoma Housing Authority, which Anthony had just mentioned. He got the opportunity to visit with them. It's very unique because we actually serve independent senior adults in that community. They're 2 high-rise senior housing units, and so we're able to really provide purpose and resources and food and just a lot of opportunities that we have at Daily Living Centers for the Northeast Center. Our South Center and our Edmond Center are much like our Bethany Center, where we focus a lot on providing respite care for caregivers and providing purpose for our participants. We have a new center that we're getting ready to open in Edmond. It's a new facility that we actually close on next week. So we're very excited about the growth. We'll be able to go from serving around 30 of our participants to around 80. And so a lot of opportunity to expand our service area. It's a big, huge, beautiful building that we're so blessed to have and be able to provide more activities. So very excited about our locations and growth that we are experiencing here at Daily Living Centers. So when a caregiver calls us, a lot of times, which many of you probably experience, they're at a moment of, oh my gosh, I don't know what to do. My loved one, is showing signs of dementia, or my, high school student can no longer remain, they're not in school anymore, but they can't remain at home by themselves. And so they give us a call. We work through different options for them in regards to financing. As a nonprofit organization, our goal is to never turn away anyone due to financial need. We provided over $500,000 in scholarships for our participants to receive our services last year. And so when they come on a tour, which I was hoping to show a video of a tour of our Bethany Center. And it's so rewarding to me because we see hope. And I know that's a big focus of Lynn Institute is providing hope in the community, but we see that in our caregivers. They arrive, they see hope, they see purpose, they see, their loved ones to have the opportunity in order to have socialization and, healthy meals. And so it's very, very exciting what we offer to our community. So a day in the life of our participants, we actually have a fleet of vehicles. We have 23 vehicles. 18 of them are limos. And so they ride around with daily living centers in style, where it was a very exciting year last year. We actually got 10 limos. I just purchased 2 more last week to be able to serve the community, that are reliable, that are wonderful brand awareness for us. And then we are getting ready to receive a bus and 2 more ADA vehicles, hopefully within the next couple months. So we pick them up at their residence in the morning, and they ride to daily living centers. They're greeted with our healthcare staff. So we're professionally staffed at daily living centers. So all of our healthcare workers are CMAs. Our drivers now are CMAs or CNAs, so that way we can provide, really safe travel for our participants, as, many of them, have health conditions, or, that we want to make sure that we can serve, during that transition to their homes or to the center. And then we have LPNs at every one of our centers. So we take their vitals. We're in partnerships and collaboration with all of the nursing schools. They're actually, OCCC was here this last week, and it was so much fun for their students to come and just engage and, love on our participants and be able to, learn to take vitals and be able to really, have some extra hands on, for bingo and activities. So it was a lot of fun, being able to collaborate with, in education for students. But they arrive, they have breakfast, and then we do activities every 45 minutes that are really, our goal is to focus on activities that really meet the needs of our participants, whether they have dementia or Alzheimer's, or if they're younger adults that are full of energy, we have a space for them to do, or, just dance. And then we have a healthy lunch. And then 3 times a week, we take them on activities. So our purpose is to provide socialization and especially for our Northeast Center, get them out of isolation. They go to fun places that I wish I could go every day, like the Blue Zoo. They went a couple months ago, and, just take them to the park to feed ducks, just to get them out and engaged and staying active. And they come back and they have a snack, and then they go home, and it starts all over the next day. So it's a lot of fun. It's very rewarding. We dance a lot, and it's amazing for us to have the opportunity to provide our caregivers a place of peace and rest, knowing that they can continue to work. They can continue, to get some respite from those 24/7 caregiver duties. And it's amazing to see the purpose and friendships that come from our services for our participants. And it's just really, really rewarding. Our transportation department is an area of growth for us. And so we're always looking for partnerships for us to be able to use our vehicles because we want to be good stewards of our resources that have been given to us to provide med rides for the community. So we're in partnership with Embark. And so we provide senior transportation to and from their doctor's appointments during the day and to get prescriptions. And we provide those services free of charge for our participants. 80% of our participants would not be able to receive our services at daily living centers if we did not provide transportation. I recently had an awesome opportunity. We had some transition in leadership, and I had, there's Marilyn. There's my buddy with Embark. So I recently, had the opportunity to do a nosedive, right, Marilyn, into transportation. And so the wonderful thing that I learned from that is how vital transportation is to our community, how vital it is to day living centers, and we wouldn't be able to function if we didn't have it. Last year, we gave $211,000 in free transportation to our participants, and it's just a wonderful partnership that we're able to have with Embark and other community partners to provide this service. And so, that's Daily Living Centers. And does anyone have any questions about what we do and who we serve? Oh, thanks. I'm going to put a link to our video. I wanted you to be able to see it so you could actually experience the impact that we have on our participants and all the fun that we have at our centers. So I encourage you to watch that at your leisure. And anyone that is interested in learning more about our services, we love giving tours. We serve the most vulnerable in our community in the middle of this pandemic, and just really proud of our team and all of our healthcare workers and making sure that we keep everyone safe, and just really appreciative to to the community in regards to helping us with funding in order to provide vaccines and do all the things that we can in order to remain open during this time.
Yeah.
Jessica,
No, that's great. That really is great, Jessica. A quick question I have is, you had mentioned that some of your folks are they're on scholarship. What are the criteria for folks to be able to be eligible for those scholarships?
That's a great question, Anthony. So as I said, we have not ever, we've been in business as a nonprofit for 47 years, and we're yet to turn anyone away due to financial needs. So it's very exciting. So if someone comes to us and we receive funding through Medicaid, Medicare Advantage waiver, VA. If you're a veteran, you receive all of our services for free, including transportation. And then we also receive funding from DHS for DVSD and senior adults. So if they don't qualify for that funding and they can't afford our private pay fee of $80 per day, then we put on what's called a scholarship. So we're the recipients of the Oklahoma County Senior Services bid. And so we actually have funds through the county that we can provide scholarships for seniors and adults, senior adults that are 65 and older. And then we also provide the free transportation through Embark for anyone that is 60 and older. So what we do is we look at all their options, we counsel them through making sure that they're receiving funds for these services. And then if they cannot receive the funds, then we usually provide up to three days a week scholarship, depending on what their need is. Several we provide 5 days a week. You can come to Daily Living Centers one day, or you can come 5. We just want to be able to provide that respite for caregivers.
Oh, that's
And
great.
Jessica, I have to say to everybody, kind of like Anthony said, when you and I first met, I was just surprised. I didn't realize you guys were at the Jelt Center over there off of Lottie. And I wanted to make sure that, the Northeast community and everybody, because you're in across the metro, but Northeast, I was just surprised that you guys were right there at Lottie, and they're doing great services. And that's where Lynn had started wanting to partner with Jessica, with Area Wide Aging, with Sunbeam, and all the folks that are doing stuff for seniors. So I'm so glad that you had the opportunity to visit with us and let people know who may not have known. And again, we've been working over there for a long time, and I didn't realize you guys were actually in the building. So thank you for your time.
Thank you.
Jessica, where are you in Edmond? You said you have a new center or a new facility?
Yes, so currently we're located right off of 33rd and Broadway, over where the Home Goods is, where I frequent often.
Yes.
But that's our current location. We have been serving there for 10 years, and we have a waiting list. That was one of my goals as in my new role, was to have a waiting list, which is very exciting because that means that there's lots of opportunity to serve. So our new location that we close on next week is located at 2600 North 2nd Street. I think that's the address. It's right on 2nd and Coltrane, where the new development of that Pub W. It was the Kim's Taekwondo facility. So it's got 3 huge rooms. It's 9,000 square feet. And it's got a huge outdoor area, which is really important to our participants because they love gardening and, you know, breathing the fresh air. And so we're very, very excited about that growth and being able to serve, you know, into Logan County and expand our service areas. Other areas that we'd love to serve as soon as possible, if we could find, you know, opportunities, would be the Yukon Mustang area. We'd love to be able to go into Union City, El Reno, and then we own land in Del City. And so that is something that we'll look at sometime in probably our 5-year strategic plan.
Oh, that's awesome. Congratulations. That's a great location in Edmond. I know exactly where that is, and you're going to have some really great access in and out of that area.
Yes, very excited. It is 1.2 miles from my house. So I'm very excited about that.
Yeah. I'm glad that you mentioned the gaps that Jessica and I have noted. I'm Marilyn from Embark, by the way, that we've noted. You know, Embark does senior transportation through area-wide in Canadian County. We have a very tiny budget for that. And Jessica and I struggle daily getting phone calls from families that need assistance out in Elmore City and Union City and Calumet. Even North El Reno is so far out that those trips, when they need to come in for dialysis treatment, if they need to come into one of Jessica's facilities for some respite care for the family, you know, we have some funding. We will burn through the funding that we have serving the existing participants that we have in Canadian County right now by January. And that means February through June, we're out of money again. So, you know, we are very much excited. If any of you have connections in Canadian County, I don't care whether it's just a church or a civic group, whatever, we need some foot in the door there to get some more people on board with us to work on this problem in Canadian County to help. Because it is a huge gap. It's just as big as the gap we've got up in the northeast side near Spencer and Jones, where individuals can't get to just dialysis treatment.
Yeah, we take calls all day for med rides, and if we can't serve them with our vehicles and our drivers in the middle of the day, then of course we give them the senior transportation line. And for about 2 months, I fielded those calls, and they're just people that need help, and they're desperate to get to the doctor, and they're sick, and they have heartbreaking stories. And so, you know, we need to be able to serve those seniors in our community because they need help.
Wow.
Yeah. Well, I'd love to, you know, facilitate any conversations or put some things together if we're able to, you know, further that conversation. I appreciate you guys, you know, for sharing that information. Jessica, you guys have some wonderful things going on. And thank you for sharing that. You know, we're excited to see you guys do well, and congratulations on the opening of your new site.
Thank you. Very excited.
Yeah, if anybody has any other questions for Jessica, feel free to put them in the chat, or if, you know, we need to connect you, we'd love to do that. With that, let's move on to our next presenter. But thank you so much, Jessica. We're glad you could be on and share with us.
Thank you for the opportunity.
I think I saw Stephanie Pharr on here. Stephanie, are you with us this morning?
I am. Good morning, everyone. Thank you so much, Anthony, for inviting me. I'm Stephanie Pharr, and I'm with the OU Health Stephenson Cancer Center. I'm one of the community outreach coordinators. And if y'all don't know what the Stephenson Cancer Center is we are the only NCI designated cancer center for Oklahoma. Our catchment area is considered the whole state of Oklahoma. So we serve all 77 counties. So for community outreach and engagement, we do a lot of preventative and screening services. That includes working with the Breast Health Network to provide mobile mammography for uninsured, underserved populations. So we go around to Guyman and we go to southeastern Oklahoma, and we just go and we help get them screening mammograms and then also diagnostic services. And the way we're able to provide those free services is through our contract from the Komen Foundation. We also do a lot of work with the tribes, and that includes different NCI funded grants that, you know, cover lung screening, HPV education, clinical trials information, colorectal cancer. We do survivorship plans, things like that. Currently, we're starting a project to do fit kits. So we're working with tribes to provide them with the fit kits. And then also we go out into the community and we provide fit kits with our huge inflatable colon. So if you ever see us out there, you know, that's one thing that we do. We have philanthropy funds to provide PSA testing for men within the community. And then we also have a research program to where if they need diagnostic services or an MRI, or if they are actually, if they need treatment, we're able to get them into that research program to help them get their treatment covered. We also partner with OU Health medical students to do head and neck checks. So we've gone out into the community and we have, you know, where they're checking for skin, they're checking for oropharyngeal cancers, things like that. And then one of our big projects that we're working on right now is we are trying to get a multi-purpose van, and we're trying to get a CT lung screening van. And if we could get those funded, you know, that would be fantastic services to be able to provide around Oklahoma. And then, you know, with our high tobacco in the state, you know, being able to catch the lung cancer early would be, that would be great. So yeah, that's pretty much it. We do a lot, we have a lot of community advisory boards, things like that. But my main thing that I do is cancer screening and prevention services.
Yeah, that's great. Oh, Steve, were you going to add something?
I was just going to say, everybody needs to come and see the inflatable colon this Saturday at Metro Tech. Stephanie's bringing it. She's bringing that out there. That's for our pancakes, prostates, and prevention that OU is sponsoring along with Integris and St. Anthony's and community health centers. And our big host is Metro Tech there at the Spring Lake campus. But she mentioned those kits. So we're going to have those kits out there and lots of different screenings, and we're going to have pancakes too. So hopefully everybody could come out there. This is, you know, National Colon Cancer Awareness Month. And we're just very pleased to have Stephanie and her team bringing all of these wonderful services to the community. So I encourage everybody to bring their men over and get them checked. We'll also be doing PSA screenings and all kinds of good stuff. So we appreciate it. And it's free.
Yeah, it's funny. We were on the call with Stephanie maybe a few weeks ago, a month ago, and Steve, you know, we're talking about this event and we're excited and we're putting it together. And then Stephanie goes, "Yeah, we can bring the inflatable colon." And I said, "Excuse me? Well, what is that? What are we putting up?" So I'm thrilled to be partnering with the Stephenson Cancer Center. I think it's going to be a wonderful event. And, you know, just in talking with Stephanie, and Stephanie, please let me know if, you know, this isn't accurate, but they're really just trying to find ways that they can partner with other folks. And so if you guys have any opportunities or events or things that screening could be done at, you know, I'd love to get you connected with Stephanie, because she's been wonderful to work with. And they're really doing a great job to try to get access to these screenings and things of the sort. So like Steve said, we're thrilled for this Saturday. It's going to be a wonderful day, right? If you got to drag one of the men in your life up to Metro Tech, the screenings will be from 9 to noon. On our Facebook page, we've got the link to register. We can dump it in this chat so that you guys can take it and share it, the link to get folks registered, but it's going to be free, right? And I'm sure if we need to figure out, you know, things like transportation of the sort, we might be able to see what, you know, depending on the need, we can potentially see what exists in terms of getting folks transported over there. But Stephanie, we greatly appreciate you being on with us, and we would love to be able to get you at more events that we've got going on, and I'm very confident our partners on the call would be willing to do the same.
Thank you. Yes, please reach out to me and let me know, because we are always eager to spend our funds and help people. So yes, thank you for having me.
And I also see, you know, Marilyn, you know, we'd love to, I'm sure we could get you some of your information to Stephanie regarding transportation and things of the sort. But yeah, if you have any questions for Stephanie, if you're curious about how you could get her maybe to come do some screening at your location, to be able to get those screenings at no cost is, just even to back to what, Jessica was talking about in Maryland about transportation, getting those no cost things in arm's reach of folks is a big deal. And so we want to do all that we can to facilitate that. Next, we've got some good presenters today. Where are you at? I just saw you, Commissioner Blumert. There she is. Commissioner Blumert. How are you doing?
Morning.
It's good to see you. How have things been for you?
Good. I hope everyone can hear me. I'm trying to talk over my air conditioner. Good morning. Thank you so much, Anthony, for having me come speak. I don't think Counselor Nice is on the call, but she and I this weekend had a little coffee get together and open it up to the community. And we had about 25 folks come out, and we did it at the new coffee shop on Northeast 23rd called Spiked. And I believe yesterday was their grand opening. And so she did a bit of a soft opening for us, and it was really fun. So I would encourage you to go try Spiked. I believe they have alcoholic coffee beverages. So maybe go there after work. Or you could just get regular coffee before work. But Brittany is the owner and is doing an incredible job, and it's a really cool little spot. So that was this weekend. I'll talk a little bit about ARPA money, American Rescue Plan. That seems to be the topic that everybody wants to hear about these days. And most of the contact my office is getting is regarding ARPA money. So if you're unfamiliar, Oklahoma County, Oklahoma City, and the state of Oklahoma all received separate pots of money through ARPA. And each of us have until the end of 2024 to allocate those funds. And I believe the money has to be spent and out the door by 2026. And if I'm incorrect, Lou or Enrique, please correct me. So the nice thing about these funds is that we have some time to plan and be strategic about how we spend them. There are guidelines from the US Treasury as to how you can spend these dollars. There are specifics, but it's fairly broad. You can invest in infrastructure, you can invest in mental health services, of course, healthcare and things related directly to COVID. You can invest in supporting small businesses. So there's a lot of different ways you can use this money. We at Oklahoma County received $77 million this year, and we'll receive another $77 million next year. So that's a total of $154 million. Oklahoma City, I think, will receive a total of a little over $120 million. So they're receiving just slightly less than us. We at Oklahoma County have decided to hire a consultant to help us strategically plan how to spend these funds, and then help us also report back to the federal government. There's quite a bit of reporting guidelines as to when you submit your reports and your strategic plan, and you have to have a website for the public to see how you're spending the money. So we have decided to hire a consultant to help us with that. The RFP for the consultant went out a couple weeks ago. we have not seen yet who has put in a bid for that contract. I anticipate it will be in the next 1 to 2 weeks because we want to get moving on this. I do want to kind of dispel some talk that is going on out there. I've been contacted by a lot of folks who have heard that all of our ARPA money is going to build a new jail. Currently, that is not true. There has been discussions among county elected officials and county staff of using some of our ARPA dollars towards a new jail facility, in addition to other sources of funding. We as the commissioners have not voted to spend any of our money yet. Nothing has been committed. So I've had a few people contact me saying, oh, we heard that you all voted to send all the money to the new jail. So that is not true. We have not spent any of our money yet, and we have not decided yet what we're going to do. What I will do after this call, Anthony, is send you a link that we are sending to folks in mostly nonprofits who have a plan to ask for ARPA dollars. We in my office just want to kind of keep track of what the needs are. And we've created a little form that you can fill out. This is not an application for funding. It's not reserving your funding. This is simply so that my office is aware of your needs. And when the time comes for us to actually start spending the money and hopefully getting the money out into the community, that we will have your contact information and we will know what your need is. So this is not, I don't want you to fill this out thinking, oh, we're going to get money from this. It's just so that we understand your need and what your organization might ask for with ARPA dollars. And I'm glad that Jessica was on the call. She is correct that Daily Living Centers receives our senior services contract with Oklahoma County. That is kind of a new contract. We used to do a grant program where we gave grants to several nonprofits. Due to our attorney having some opinions about how that program was going, we switched to a contract for services model. And so we do a senior services contract each year now. And then we just started a new program in partnership with Cardinal House. Anthony, I would encourage you to have someone on from Cardinal House in the future because they do really good work. So we are contracting with Cardinal House to provide what we call respite care. Respite care is services for individuals who are coming out of a hospital, coming out of a medical setting where they would otherwise be going back to homelessness. And it is for folks who don't really need a high level of medical care. It's not safe for them to go back to a homeless shelter or to go back to living on the street. So we at Oklahoma County contract with Cardinal House and we help pay for respite care services. So they have a whole wing of their facility where they house folks who just need kind of a temporary place to be while they're recovering. And they have someone who checks on them multiple times a day. And Cardinal House is downtown. It's kind of by Scissortail Park. They used to be called Oklahoma Halfway House, and they now are called Cardinal House. And their director is named Kelly Uday, and she is wonderful. And since we have started this respite care program, the hospital systems have gotten interested in this as well, because they know that when they're discharging someone, if they have nowhere to go, if they're homeless, the hospital will probably see that person again. If that person is going out to homelessness. So the hospitals are getting interested in putting some funding into this as well and expanding the number of beds at Cardinal House. So that's exciting. And Jessica being on here made me think of that. My staff and I got to go tour Daily Living Centers before COVID a couple years ago, and we did get to see the limousines. I was jealous. So those are two of our newer social service contracts that we do here at Oklahoma County. My last comment is about redistricting. That is also a hot topic right now. The state legislature will redistrict this year, city council will redistrict, and so will Oklahoma County. We do not have to vote on our new districts until the end of November. So there is a staffer in the state Senate who drew all the new districts for the state Senate. He is helping us draw the districts for Oklahoma County. And you all may or may not know, we have 3 county commissioner districts in Oklahoma County. They all have to be about equal in population. Because the northern part of the county, Edmond, Deer Creek, because that part of our community grew so much in the last 10 years, I now need to gain about 20,000 people when we redistrict. So the northern district, which is District 3, Commissioner Calvi, he needs to lose quite a bit of folks, and I need to gain folks into my district. So it'll be interesting to see where I gain those people from in the county, and I'll get to go knock on those brand new doors and introduce myself. And so we'll vote on that in November, maybe October if the map is ready. We will have one public hearing. before we officially vote on the new districts. I don't know when that public hearing will be, sometime this month or in October. We haven't quite planned it out yet, but we will have a public space for people to come, give their opinions, see potential maps, and have a say. So I will keep you all informed of when that hearing is. And I think those are all my updates.
Well, I really appreciate you being on. It's good information. You know, whenever I ask you to be on, I always go, you know, she's gonna bring something. So
Whatever you want to talk about, Carrie.
I always love just throwing it your direction. So I appreciate you being on. Yeah, if you get us the form to fill out, I'll gladly get that to everybody on there. Just, you know, I'm just going to remind myself of the caveat. This is not an application, right? And so, Commissioner, we really appreciate what you're doing. We appreciate your insight and you taking time to be on with us. We just really want to stay informed, and you do such a great job of helping us do just that. So we appreciate you.
Thank you, Anthony.
And if anybody has any questions for Commissioner Blumert, I know her team is wonderful, you know, wonderful at, you know, getting the answers to where they need be. And so feel free to put something in the chat. If we don't miss it when I'm going back, I'll make sure I get it over to Lou. Is Lou the best bet, or directly to you, Commissioner Blumert, if anything comes through? Carrie, if anything comes, oh, perfect. So I'll make sure I get that over to them.
Okay, perfect. Lou's going to send you an email.
Perfect. With that, you know, this next group that we've got on does not need any introduction whatsoever. They've literally been doing such great work, and recently we've been able to do, you know, a bit more with them. Jonathan, I just saw you on. Jonathan is, and correct me if I'm wrong, I'm pretty sure, Jonathan, you're the Director of Jobs over at RestoreOKC, and really kind of lead the way as far as the market at East Point and your programs and your efforts and things going on over there. Is that correct?
That is correct, Anthony. Thank you so much for affording me this opportunity. Just share a little bit more in depth about what we do. Obviously, as you said, we're not strangers to the group on this call today. A lot of you have been contributors at various levels to the success that we're experiencing, not only at RestoreOKC, but specifically at the market at East Point. So on April the 20th, we were able to open the market, employing individuals from our community. So the market is staffed with 82% of the individuals there from our community, 39% are in walking distance. And so not only to have an ability to provide access to healthy food, but also employment has been, you know, really for us essential to seeing our community thrive and flourish. And so, you know, over this time, we've kind of found our groove after having a strong opening, and now with the new Homeland opening at 36 in Lincoln, now finding a new groove, we've been able to roll out a new program, what I feel like is really pretty cool with the incentive that comes with it, which is called Double Up Bucks, which is through Hunger Free Oklahoma. So 60% of our point of sale transactions are EBT or food stamps, SNAP benefits. And so with this program, individuals who use their SNAP card at the point of sale transaction, there's a dollar for dollar match up to $20 each day that those participants can use toward fresh produce. And it's been amazing just to see the wow factor for those participants to see this new incentive that they have. And so, you know, one of the things we've been really coaching and our team to share with the participants, not only to get those things that they are familiar with, but to try some new fruits and vegetables. I'm not a butternut squash guy, but I've tried it myself, and my wife is now making butternut squash soup. So I'm trying to expand my palate around those types of things. But we're really excited, you know, with what's taking place there, not only for the customers who are coming in, but also for our team. We've been able to expand our adult job training program, taking individuals from where they are to where they desire to be, and using that employment as kind of that in between for them. seeing so much success with that 87% graduation rate with that program. Seeing, industry partners come in and help with mock interviews. The individuals, just their confidence level just rise as they get more reps in interview skills and learning team dynamics, which I think is just making our community stronger and stronger. So just thank you guys so much for the respective contributions. I would name the names, but I'm sure because my mind space is limited right now, I would forget someone. So when I say thank you, thank you. So in the chat, I'll leave my contact information. I'll leave a video from our grand opening. So I'll open up to any questions that anyone may have about what's going on.
Real quickly, I want to add that, and we've been talking about our On the Road to Health program for some time now, and it's been wonderful. We're 4 cohorts in. We've been able to do so much great work with women in Northeast Oklahoma City. One of the greatest things that we've been able to do, and we're so thrilled about, is this past cohort started just last month. We've been able to shift all of our sourcing of food and components to the market at East Point. And I really want to give Jonathan a pat on the back because you guys have been doing such a phenomenal job. Your customer service is so wonderful. You guys go above and beyond. And so I genuinely, want to thank you for that. It's been a great experience. Our participants, it's really cool to be able to walk into this class when we're giving these resources out and discussing all these elements, and to be able to be handing these folks resources from the same community that we're in, right? We're so thankful for the partnership we've had with Homeland to be able to do that, but it's just a little different. It's just a little different and really exciting to be able to do that. And you guys have been so great about it.
Anthony, I'm glad you highlight that. I was over at the market this morning and I had a customer just to share that with me, how it's just a different feel when they come into the market. And that was one of our goals when we decided to, from a recruiting and hire perspective, to strategically make sure that the bulk of our staff, 75% or higher, are from that community, because we wanted that time for people to come into the market to be relational and not just transactional. You can go anywhere and get a bag of sugar and get out. There's a reason why we don't have self-checkouts. We want that to be engaging. We want that experience to be memorable and remarkable, because individuals that come into, we don't know kind of where they are in that moment. And so to have a moment or a space to be a beacon of light for them in that moment, we just welcome that. Individuals' dollars are valued, and we want to make sure when they come that they know that not only it's their dollars valued, but they're valued as well.
Yeah. Well, and I also have to brag on the eatery, right? Before we started the class, we didn't know where we were going to get lunch, and we had that first one. This not just like any old lunch. This is good. This is good food. So if you're in the area, ever want to swing by get some lunch, hey, it's good. Just so you know, it is. It's not like I'm gonna go support. No, it's worth driving out of your way to go get food to eat there.
Anthony,
go ahead. Yeah.
Okay, so Jonathan, I'm BJ Glover. I just wanted to say, my goodness, I was so thrilled the first time I went into the market, and with the professionalism and the hospitality that the employees demonstrated. I loved that, and it's wonderful every time. My question is, can you explain the relationship between you and Homeland? I heard a customer asking about it. On the surface, it looks like this could be competition for you, but can you explain that relationship?
Certainly, yeah, it is not competition at all. It's actually a partnership. So the unique, uniqueness of this partnership is, as a community development organization, it would have taken us 7-8 years to just get a baseline knowledge of just the grocery business. And so with Homeland, being experts in that area, this private-public partnership was able to be able to roll out. And so RestoreOKC as the 501c3 owns the actual property, and then we charge Homeland with staffing a store and assistant manager. because they have the expertise in the inventory, the systems, and the buying power. And so with that partnership, it just helps us from that end to make sure we can provide the highest quality of products for our community. But the staffing is 100% from RestoreOKC. And so, like I said, we use that job training program to catch individuals where they are and where they desire to be, and create that roadmap for them. And this is before we opened the market, I had calls, and I visited other community markets like this, but this is the first private-public partnership that has been rolled out, that to my knowledge, across the country. And as a result of our grand opening, I've received so many calls and just questions about, like, share with me this unique situation. And the best way I can say it is, Homeland kind of put themselves out there to make this happen. And so obviously we're definitely grateful for them for the partnership. But it is a unique situation that there's some ins and outs that we had to work through, but because we all laid our egos to the side for the greater good of our community, we were able to make it happen. And so I was on a call yesterday with a group from Houston who's looking to roll this same thing out in a community similar to the Northeast side.
Jonathan, we really appreciate you. You guys are doing such great work. We appreciate the partnership, and I think what I really want to highlight is all of these programs, all of these opportunities for folks to gain access to resources. It's the collaboration in them. It's the collaboration that allows us to come together and to build upon these things. And I always tell folks, we're always trying to find ways to collaborate and to make things go well. So Jonathan, thank you so much. I appreciate you being on. If anybody has any questions for Jonathan, love to get you connected. If his info is not in the chat, we'll get it in there. But such great partners, and like I said, you guys don't need an introduction with all the great things that you've got going on in the community. With that, I want to toss it over to my colleague, Miss Jeaneen Pointer. Jeaneen, I saw your face on here. I know you guys know Jeaneen. Jeaneen's the Chief Strategy Officer for the Lynn Institute, and she's busy these days with our Hope initiatives and things of the sort. And so I just really wanted to make sure we had some time for Jeaneen to highlight the work that she's got going on right now.
Thank you so much, Anthony. I appreciate that. And yes, we are doing lots with Hope. As you guys know, Lynn made the commitment to integrate Hope into our whole culture and our core values. And so we have been busy working on that. I just wanted to let you guys know of some things coming up in case you're interested, and in case you want to integrate Hope into your organization. What we're seeing, one of the things that we have been doing now on this 4th cohort of On the Road to Health, we have integrated Hope into that. And we actually assess Hope just like we assess the other pieces that we put together for their health. Their Hope is assessed, and we integrate Hope through that too, because it's the greatest predictor of success and well-being, put up against 2,000 other kinds of studies and that kind of thing. So behavioral change happens when Hope is integrated, and an organization changes when Hope is integrated. And so we're looking at that for success in the programs that we offer, but in our organization and everything that we're endeavoring with. So I wanted to let you know that we do have a Hope Navigator class starting on September 22nd, and I did put that in the chat for you. But I want you to know, because this will be the last Hope Navigator class for the year. So we won't be offering this again until 2022. It's just, there's too many things conflicting, and with 2 holidays in there and that kind of thing, it's just not possible. So if you had any inkling to get at least one or two of your staff in. I do have some openings for that class to start. And I would really encourage you to do that. It does make a difference in what you're doing internally, as well as what you're putting out there externally. So that class will meet 3 times on the 22nd, the 29th, and October 6th. And it's just from 1:30 to 4:30 each one of those days. So if you have anybody that you want in that, that would be great. The other thing that I want to let you know about is that we are doing another afternoon, it's just a 3-hour class on October 20th. And if you are a leader in the organization, it doesn't mean you have to be the CEO, but if you are on that leader team of your organization, this particular session is it's going to be all about leader hope. What does it look like to be a hope-centered leader? What does it look like to convey hope to your employees? What do hope-centered job descriptions look like and performance evaluations look like? What are hope policies that you can put into place and put that overlay on all of your policies and procedures? Even what can you do to employ strategic planning in conjunction with hope? And I will tell you, just since the time that I've been doing hope, that's one of the things that I love the most, is the strategic planning component of how hope just really streamlines that when you start looking at it from the hope perspective. And so that will be from 1:30 to 4:30 on October 20th. And we'll be sending out some details on that here in the next couple of days. Also, I just wanted you to know too, we have some exciting things with Hope happening outside of Lynn and what we offer. And I just was able to start with the new class with the Center for Social Innovation yesterday. And those students go through our Hope training and utilize Hope in their purpose and their goals as they get this second chance to approach life a little bit differently than in the past. And so that's exciting. We've begun our efforts at Oklahoma Baptist University for them to become, and BJ is one of the leaders of that, but for them to become a hope-centered university and one of the first in the nation. And so that is going on. I also wanted to let you know, sometimes it's hard to get your employees out of the work setting just to go to something, like our Hope Navigator training. But if you have 10 or more at your place, I will come to you. And if that would make it easier for you, we can work that out, but I will actually come to your organization and train if that is something that would be of interest. So we have all kinds of things going on and assessments going on with Hope out in the community, that kind of thing. So, and then if just on a side note, because I'm always trying to raise money for our efforts, we do have, if you came last year to our charity, and it's like the word charity and table auction, we have those in progress, and we have about 30 artists who are taking tables of all kinds and chairs of all kinds and actually making them into works of art. And that auction will be at North Park Mall. It's on your mobile phone, so you can be at home, or you can come have some fun at North Park Mall with music and cash bar and food and that kind of thing. From 4 to 8 on November 4th, and we'll be auctioning off those wonderful pieces, and you'll be getting more information about that too. So put that on your calendar. We'd love to have you. Thanks so much.
Thank you, Jeaneen. I appreciate that. And if there's ever, if you need to get connected with Jeaneen to discuss Hope or things of the like, Jeaneen, I think she put her email in the chat. I'd love for you to reach out to her. Before I throw it over to our CEO, Steve Petty, I just wanted to remind you guys of an event coming up. So obviously this Saturday we've got Men's Health, but on September the 25th, many of you will be vendors at our Zoo for You event, which is a free community event for folks in Northeast Oklahoma City to go to the Oklahoma City Zoo for free. We've got flyers, we've got digital flyer. literally the only requirement is that they live in Northeast Oklahoma City. The zoo's been very gracious to work this event with us. There'll be opportunities for them to get screenings, vaccinations, giveaways, fun little activities. And so if you have a group or folks that you work with that you would like to get this flyer to, let me know. The only thing that we ask is that it isn't shared on social media. We want to do all that we can to keep it as set up for the Northeast Oklahoma City as possible. But if you've got a group of any sort and you could benefit from getting them that digital flyer that they can use to get in, or that physical flyer to get in, shoot me an email. We want to get as many people in the community access to it. We just really want to do all that we can to keep it for the Northeast Oklahoma City community. And so that'll be on September the 25th from 10 to 1. And just shoot me an email if there's anybody or any group that you'd love to get access to that event. No cost, free opportunity, free snacks, free activities. It's going to be a fun day. So let me know. But with that, Steve, I want to throw it over to you.
Just quickly, thank you again, everybody. I just wanted to throw it out there. Like Anthony said, the collaborative, we enjoy being with you guys, and we really hoped that this month we would be able to get back together. But one thing, I've been working with Lynn for 2 years, and before that on the board. The collaborative is a 10-year project, and we're in year 6. And I will tell you, even during the pandemic, I feel like we have been doing more. We may not have been together, but separately and on Zoom, the projects that are going on in Northeast Oklahoma City on the road to health, the food distributions, all the different things we're doing with Hope, all of those, and working with our partners like Valerie at Metro Tech and Anthony Stafford. Wave, Anthony, he's new with Sunbeam. He's our new guy. Well, thank you for being here, Anthony. And the lovely Lisa Sinar working with us for our Pocket Park with Tabitha. But also Pam Patty, LaDonna Hines, helping us with the On the Road to Health. All of you coming together, and there's so many of I haven't mentioned, but Jessica and Carrie Blumert support, Nikki Nice's support. I'm rambling on here, but I'm just letting you guys know our team is so thankful that we have you. We can pick up the phone. Marilyn, we need help with transportation. It's just, Lisa, help. We've got to, it's just amazing that we've all been coming together. And even though we haven't got to get together like we wanted, we're going to continue to have these on a more often, so we can touch base and we can let everybody know. Jessica Clayton's over at the Jealth Center, and all of these other things that have been going on that even in your own backyard, sometimes maybe you don't know, or maybe you do, and you need to let us know about it, because we like to be the folks that are out there helping promote and do what we can do to help you with your mission, and ours, with our mission to improve the health of the community as well. But we're so excited to be able to do what we do. And I feel so, thrilled that we're really making inroads. Are we where we need to be? No. But the things that is going on in Northeast Oklahoma City, and the stakeholders that have allowed us to come in and stand by them and help, we just want you to know how much we appreciate it. We've got a lot of stuff that we've been putting in the chat. I ask you to look at that tonight, tonight at 6:30. We're going to be at East Zion. Pastor Cheryl is hosting us for a men's health talk with Dr. Adam Alexander from OU. So there's a lot going on, and having this opportunity to visit with everybody and tell you what we're doing, and all of us talking about hope. I mean, hope is going crazy, and I'm so thankful that we've been able to do that, and you all have been so supportive. So again, I'm rambling, but I want you to know how much we appreciate you. We will be in contact with you anytime you need us, and vice versa. So thank you so much for all you do and for making us be a part of this community. And we just appreciate what the future looks like. So thank you all.
Yeah, thank you guys so much. We appreciate you for being on. If there's ever anything, right? I always make the comment, and I probably shouldn't. Worst thing anybody can ever say is no, right? So please, if there's ever anything we can do, reach out. We'd love to work with you. Thank you so much for taking a little time to be on with us this morning, and hopefully we'll see you this evening and this Saturday. But you guys have a wonderful day, And
This evening's at 6 o'clock, not 6:30. My apologies. Steve just corrected me. My fault, my bad.
yeah, so tonight, 6:30, Greater New Zion.
6.
And
6.
oh, did I say 6:30?
I
Oh,
said 6:30 too, so
you
don't
throwing
listen to
me
me.
off. Tonight, 6 p.m. 6 p.m. Greater New Zion. We'd love to have you guys there. Thank you, Donna Thompson, in the chat for coming in clutch for us and correcting us. We look forward to having you guys there. But with that, I hope you guys stay safe, and we look forward to seeing you guys in the near future. You guys take care.